For this video, we'll be starting on the abdominal wall of the pony specimen. So we'll look at some of the muscles on the wall, and then you'll be reflecting them to palpate the internal structures. So you'll actually be putting on a palpation glove and sticking your hand in to the abdomen to feel structures before we actually remove the contents. So we'll start and we'll just take a little bit of a closer look. We're just going to look at the abdominal wall here. So here we're looking more closely at the abdominal wall here, and I want to just point out you may have these or you may not have these on the left side. So we're on the left side of the pony here, but you may have these subiliac lymph nodes. So this is the subiliac lymphocenter in the pony. It's just a bunch of little tiny lymph nodes. So you may have that on the left side or you may not, but be sure and look for it on the right side where you still have that limb attached. All right, so we're looking at the abdominal wall, and we're starting with the external abdominal oblique. So mine looks a little funny because it's curling up because I've already reflected it, but your external abdominal oblique will extend up to the ribs around the costal arch here, and it goes all the way down here. And so that's going right up to the edge of your rectus abdominis muscle. So rectus abdominis is the one that's going to run straight down the belly. And so we're going to reflect this external abdominal oblique all the way down to the rectus abdominis. So you're just going to cut it away from the lumbar area, and then you're going to cut it right in front of where your thigh would have been. So your leg would have been here. So you're going to cut it right in front of there, and you're going to reflect it distally. One thing to note here is that most of the caudal edge of the external abdominal oblique is actually an aponeurosis, and it's kind of a yellowish looking covering over that, and it's called the tunica flava abdominis, and it's kind of elastic and it's slightly yellow, but you can see here I've reflected just a little piece of it, so you can see there's the muscle and tendon junction there, and it's just a covering. So tunica flava abdominis, so you want to make sure and see that it's kind of covering over the whole muscle here. And so you'll reflect your external abdominal oblique distally towards the ventral midline of the belly. And so you'll take that all the way down until you see the edge of your rectus abdominis muscle. So here I'll try and just pull it out a little bit. So rectus abdominis is here, so that runs down the belly like that. And so until you reach the edge of it, and then also on the left side, if you want to, you can actually just cut off the external abdominal oblique so that you can get a better look at this rectus abdominis. Then the next layer is the internal abdominal oblique. So the internal abdominal oblique is this next part here. So you're going to make a similar cut. You're going to cut it away from the lumbar muscles, and then again, just right in front of the leg where the leg would have been. And you're going to reflect just a small portion of this, and you'll cut right behind the last few ribs here. And you want to just reflect the dorsal part distally. So just that part, enough so that you'll be able to get your hand inside. So we're just making a hole or a window here. And so you just want to make it large enough to be able to get your hand inside. So we have internal abdominal oblique, and then we have the transversus abdominis is the next layer. And transversus abdominis tends to be pretty thin. And again, you're going to do a similar cut along the lumbar area here, and then reflect it distally so that you're actually entering the abdominal cavity. So once you're in there, you'll be able to see some of the structures that we'll see and list on the terms list. But you're going to put a palpation glove on and put your hand inside and palpate some of the structures that you will have on your list. You can also make a window through the diaphragm if you want to. And so typically I just kind of cut it away from the costal region, and I just cut it and pull it away to make kind of a door or a window so that you can see more of those structures that you will be feeling, and so you have a better visualization of that. So here you're seeing the spleen right here. This would be spleen. And then you're seeing colon here, so that'd be left dorsal and ventral colon. So those are a couple things that will be prominent on the left side. So now we'll go ahead and take a look at the right side of the animal. So here we're looking at the right side of the pony, and we're just going to work on these same abdominal muscles on the right side. First, before you work on those, I want you to make sure and see the subiliac lymphocenter, so all these little lymph nodes, and that's just cranial to your thigh muscles of your leg. So the leg is right here, thigh muscles, and just cranial to that you'll look in this fat and fascia for these little lymph nodes. So that's the subiliac lymphocenter right there. Then you'll be uncovering your external abdominal oblique. You may have a lot of fat or fascia, but you want to take at least some of it off to be able to see the external abdominal oblique muscle. And then you again have that tunica flava abdominis, which is the yellowish covering. It's kind of an elastic covering over the muscle. And you'll make your incisions dorsally along the lumbar area here, and then along the costal arch, and then again just cranial to the thigh. And you're going to reflect that distally and take it all the way down until you reach the edge of that rectus abdominis muscle. So the rectus abdominis is the one that runs all the way down the belly here. So if I stick my probe here, you can kind of see the edge of it. So here's the rectus abdominis muscle. The next layer we have is the internal abdominal oblique. So here's the internal abdominal oblique, and you'll make a similar cut, but we're only taking it down enough to get a hand inside. So you're going to palpate first, and then later we will actually reflect them further. So you want to cut dorsally along the lumbar area there, along the caudal edge of the ribs, and cranially along the thigh, and just take that distally enough that you would be able to get your hand inside the pony. Then the last layer here, it's very thin, is the transversus abdominis muscle. So here's transversus abdominis, and you make a similar cut dorsally and then caudal to the ribs, cranial to the thigh, and take that down as well. So here on the right side, one of the prominent things you'll see right away is this big bulging section, and this is going to be your cecum. So this is the base of the cecum that you're seeing right here from the right side. And then if you want to make a diaphragmatic window again, you can do that. So typically I just cut the diaphragm away from the ribs and then I reflect it. And then you'll be able to see more of what you're going to be palpating. So here you're getting a view of the liver, and then the right dorsal and ventral colons are going to be here. So you want to go ahead and put on your palpation glove, and you'll palpate those structures inside the animal. And then we'll make a cut that actually connects your two incisions for your abdominal walls. So you're going to connect this and take it all the way down to the midline. And then you're going to do that on the other side as well, so that your cuts meet on the midline. And then you're going to drop your abdomen contents onto a table. So all of the GI tract will be on a table. And then you can see the dorsal attachments and the attachment points inside the body before you fully remove it. So here now you can see that I have made those cuts through the abdominal wall and dropped all of the abdominal contents down onto a table so that they're resting on a table, but you can still see their attachments within the body. So we're going to take a look at some of those structures you were palpating before we cut away the wall. And we'll look at those, and then a couple of vessels in this area. And then some of you will actually be removing the abdominal viscera completely and then studying it on a table, and others will be leaving it in situ like this. So as you can see, I connected those abdominal wall cuts. So here's the abdominal wall here that's been reflected, and I connected my cuts on the left side and the right side, and you make them a ventral midline connection, but especially in the males, you need to be careful and not cut through the penis. So just go cranial to the penis and cut through, but don't cut the penis. So make sure you're connecting those, and then if you need to, you can make a ventral midline cranial incision kind of going up towards the rib cage. So you can do that so that the abdominal contents will kind of come down onto the table a little easier. So once you do that, you'll be able to see some of the things you were palpating. And here in this view, you can see right here is the small colon. So this is all descending small colon here. And you see a lot of mesentery. So the mesenteries are basically named for what they're attaching. So mesentery here would be mesocolon, since it's attached to colon. Then here we can pull out some of the jejunum. So you can see jejunum in here. And you have mesojejunum as mesentery attached to jejunum. So mesojejunum would be there. Also in here, I can pull them out and you can see there's a little bit of pink streaks, and you can see these arteries. So these are going to be jejunal arteries. So you can kind of see them running down to the jejunum. So you'll maybe be able to see a few of those in this area here. And then what else can we see? We can see the edge of the spleen right here. And then if I lift up my diaphragmatic window, you can see the apex here. So there's your spleen. Then you also have stomach in this view. So you can see the greater curvature of the stomach would be here. So stomach. And we also see the left lobe of the liver poking out here. Then we also have the dorsal and ventral colons. So we have the left side, so left dorsal colon would be here, and left ventral colon is much bigger on the bottom. So left ventral colon here, which you can also see them here as well. So left ventral colon, and then when you're switching from ventral to dorsal, you have the pelvic flexure. So that's this turning point in the caudal aspect. So left ventral colon goes around the pelvic flexure, and then you have left dorsal colon here. The other thing I want to show you on the colon are these arteries that were nicely injected on this specimen. There are two arteries feeding into the colon here that I want you to take a look at, and hopefully your specimen will have nice injection like this one does. Here you can see the red, and it creates a loop around the colon. So on the ventral colon, you have this very large colic artery right here. And then as you move to the dorsal colon, it's actually going to be the right colic artery. So right colic artery connects with the colic artery, but colic artery is on the ventral colon, and right colic artery is on the dorsal colon. Right, so the other thing I want to show you on this left side before we move over to the right side is the ductus deferens and the bladder, the urinary bladder. So we'll take a little more of a cranial view so you can hopefully see into that pelvic inlet area for those structures. So here, this is a male specimen, and I just want to point out the ductus deferens and where you would look for that. So the ductus deferens, you can see it right here. So it's kind of in that pelvic region here. Ductus deferens, and then I also wanted to try and point out, way back in the pelvic inlet here, is the bladder. So it may be very small, usually they're empty, so you don't see them very well. But the bladder would be way back inside the pelvic inlet there. Now we're taking a look at the right side of the pony. So we're going to look at some of the structures that you palpated from the right side. And here, the main one that sticks out right away is the cecum. So the cecum is very large. And it's this comma-shaped structure that kind of bulges out at you as you drop the gut down. So the cecum has a base, and so that's going to be the dorsal part is the base. Then you have a body of the cecum that's kind of traveling distally. And then the apex, if I just pull it out, you can see this blind end here is the apex. So that's all part of the cecum. And the cecum you can open up with an incision to see inside to look at the ileal orifice and the cecocolic orifice, but we'll look at that in just a moment. I just want to finish pointing out some of the structures you're going to see from this right side. So if you lift up your diaphragmatic window, you can see the right lobe of the liver here, and then you're seeing another part of your colon, so your large colon here. So that's kind of poking out there, and you can see part of the colon here, so you would have right ventral colon, and then right dorsal colon wrapping around. You can also see part of that descending small colon here as well. And then wrapping around the base of the cecum, you have part of the duodenum. So that's this kind of flap right at the top of the base of the cecum. And so hopefully you palpated that and were able to see that. And that's actually forming the caudal flexure or caudal loop of the duodenum. Either term is fine. So that kind of loops around there on the base of the cecum. And now we'll go ahead and take a closer look inside the base of the cecum here where I've cut it open to see those openings. So here I've opened up the base of the cecum, and you can find the ileal orifice here. So that would be right here. I'll just stick the probe inside it so you can see it. That's where the ileum dumps into the cecum. So ileal orifice is here. Then you have the cecocolic orifice. So you have to go slightly ventral and cranial to that ileal orifice to find it. And you're just going to stick the probe in it here so you can see that. So that is the cecocolic orifice. So that is going from the cecum into the right ventral colon. So cecocolic orifice, ileal orifice here. And we can actually, if we pull this away and kind of scooch it forward, hopefully I can find the ilium and kind of pull it out for you to see that it matches up. So here's the end of your ilium, so the terminal part of your ilium where my thumb is. And then if I kind of turn this back over, you can see that's right where the ileal orifice is inside the cecum. So hopefully you can find that ilium coming in to the cecum there. So after that, we want to take a look at how we're going to take out the abdominal contents for those of you that are going to remove them. For those of you that will be removing your abdominal contents, you will want to make your cuts cranial to the diaphragm. So we're actually going to be taking the diaphragm, or most of the diaphragm, with the abdominal contents when you take them out. So going cranial to the diaphragm, you want to cut through your esophagus, your caudal vena cava here, and also your aorta. So all of those things you want to cut just cranial to the diaphragm and kind of take those stumps with the abdominal contents when you take them out. So once you've cut those, you can connect your two diaphragmatic windows where you started making those holes and just connect them across, straight across the midline here, and then push that caudally to go with your viscera. So you'll actually remove your diaphragm with the viscera and kind of pull everything down. Then you also have to tie off your small colon. So in the caudal aspect here, if you take two strings and you can make a little space in between them, but tie off so we don't contaminate the whole specimen with fecal material. So you want to make two ligatures, just a few centimeters apart, and then cut in between the two parts, and then you'll actually take the small colon out with the viscera, and you'll just have a little stump remaining in the pelvis back there. The other thing you want to do here is to find the terminal portions of your aorta. So those will be branching, and you want to cut cranial to the branching point. So we want to keep those external and internal iliac vessels with the pelvis so that we can dissect those with the pelvis. So make sure you're cutting far enough cranially so that you keep those branches with the pelvis.